You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me and listening again this week. I've got so many topics to cover for you to help empower you to make better choices for your oral health and overall well-being. I'm a dentist with over 30 years experience. I graduated in 1992. And as many of you will know, if you're regular listeners, I have my own dental practice here in Brisbane called Evolve Dental. And if you'd like to find out more about my practice and holistic dentistry, then hop on over to holisticdentistry.au. Decided to mix up the format a little bit more for everybody now that we're so many episodes into the podcast. And this one's going to be a little bit shorter today, but don't worry, I won't hold anything back. You're not going to miss out. I'm going to still give you great information and pack lots of punches to bust some of those dental myths that are out there. So let's get to it. Let's get in the zone. I'm going to talk about headaches and how they can be related to your teeth and your bites. If you've got a headache, you should go to the dentist because it could just be your teeth. Now, I'm a holistic dentist and it's my role to want to empower you to make better choices for your dental health and your overall well-being. So let's have a look at why headaches can be related to your teeth, your bite, and your jaws, because it's a very important and often overlooked factor of why we suffer from headaches and migraines. So I'm going to share this with you today, so stay tuned. So I actually hate it when I get a headache, you know, that crushing pain in your temples, eyes that feel like they're about to fall out of my face, and that throbbing that makes me think that my head might just explode. A headache has me quickly reaching for a painkiller, and I don't take them easily. I like to have a lie down in a quiet, darkened room with a soothing eye pillow on my brow, and I like to wait till my headache subsides. Now, thankfully for me, headaches are quite a rare occurrence and almost a thing of the past. But those people who regularly suffer from headaches and migraines are not so fortunate. Headaches can be extremely draining and debilitating, and for many, they occur so frequently that normal everyday life becomes extremely difficult. Often when we have a headache, the first thing we do is reach for some sort of pain relief. When that doesn't help and the headache persists or keeps recurring, we may even visit the doctor, and we should do, to seek advice and assistance. Make sure we rule everything out. But did you know that your dentist might be able to help? If you suffer from headaches, migraines, facial pain, pain behind your eyes, pains in your neck and shoulders, you should mention this to your dentist, as the cause may actually lie inside your mouth. The cause of your headaches could be due to problems with your bite, for example, which is known as your occlusion. The way your teeth meet when your jaws close together, this can impact on your jaw joint, which is just here, and the surrounding muscles, and there's plenty of them. So if your bite is out of balance, it can have far-reaching effects on your health, your posture, and your well-being. Often patients will come in and they'll say to me they think they have TMJ. What they actually mean is that they have a problem with their TMJ, which is the shortened term for the jaw joint. Temporomandibular joint. You can see why we call it TMJ. And disorder of this is a neuromuscular condition caused by imbalanced bite. And when the bite is out, the jaw joint causes pressure on the nerves, the ligaments, the tendons, the muscles, and the blood vessels in the head. And that can result in headaches, migraines, facial pain, tinnitus, and even quite severe toothache. TMJ problems can be caused by an imbalanced bite, postural problems like a head forward posture, one leg longer than another, habits like chewing your fingernails, and also because of clenching and grinding our teeth at night, which is due to postural and nutritional imbalances and airway problems. Many people have an imperfect bite and they never show any symptoms because their body is able to shift and adjust. But for those who can no longer adapt, some will get headaches, while others may experience problems with their teeth or their gums, such as broken and fractured teeth, broken fillings, teeth that are becoming loose under the pressure, or toothaches that have no obvious cause. You can even get receding gums from an uneven and poorly aligned bite. So how can your dentist help? Well, depending on your problem, it can be possible to spot the signs of dental malocclusion or poor bite with a simple jaw joint and bite check or an analysis. As part of your holistic dental care, I regularly check the position of the jaw joint, the movement of the jaw, and I check for any clicks along with tenderness in the biting and facial muscles and those of the neck and shoulders. I also look for signs of wear and tear on your teeth, cracked teeth, worn fillings and gum issues, all of which are telltale signs of TMJ issues and grinding problems. As your holistic dentist, I might be able to help you directly by addressing your dental issues and supporting you with lifestyle and nutritional changes, as stress and mineral deficiencies can also play a role in TMJ and grinding problems. It may be necessary to provide you with a night splint that you wear during your sleep that assists you to relax your jaw muscles and allow your bite to normal up a little bit. I might refer you to a specialist who deals with occlusal problems. In some cases, your teeth or fillings may need to be carefully adjusted so they meet more evenly, and changing the direction and the position of the slopes that guide your teeth together, that can help reposition the jaw. If your teeth are too far out of line or totally incorrect bite position, it may be necessary to have braces to move them into a better position. We might also need to organise a sleep study. The TMJ needs support from both sides of the jaws. If you've got missing teeth, especially at the back of the mouth, these are going to need replacing, as the chewing action is designed to work properly only when all your teeth are present and the correct positioning is there. The missing teeth can be replaced with a partial denture, bridge work, or implants. Old and worn fillings may also need replacement to improve the biting function and to provide additional support and balance for the joint. As with any joint pain, it can help to put less stress on the joint and the muscles around it. So we'd recommend a soft diet, anti-inflammatory medications, and these can be very helpful, as can corrective exercises, self-massage, and external heat. I find that bodywork, facial physio, and jaw exercises and supplements can often help. But it's also important to address underlying stress, emotional issues, sleep breathing disorders that could be leading to the mispositioning of the jaw and clenching and grinding. So if you think your headaches, facial or neck pains could be from TMJ or grinding issues, my advice is don't suffer in silence. Call us and speak to us today so we can assess your jaw joints and your bite. Our number is 0737 20 1811. Or you can email info@holisticdentistry.au. I hope you found this useful. I'm Dr. Rachel Hall. This is the Dental Zone podcast, and I will be back next week with another episode of the show. Until then, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.